Today we're going to talk about specific part of immune system. And when I'm talking about specific part of immune system, I'm talking about specific immunity. Which is the difference between specific and non-specific immunity? Do you remember? What is the difference between specific and non-specific immunity? Whenever you can hear such terms as specific and non-specific, you should put a question. Specific or non-specific is related to what? Or who or what is the main character of this issue? Specific for what? Non-specific for what? Or for whom? Immunity is about what? Immunity is about protection, mostly against extrinsic factors and at the same time for intrinsic factors, right? When we are talking about extrinsic factors, we can divide them basically in two main groups: allergic factors and infectious factors. When we are talking about allergic factors, that can be related to any organic substance, either lipids, either sugars, either proteins. But the biggest allergic capacity will have which one? Protein. Proteins will be more allergenic than other organic substances. This is why when we are talking about allergens, by default we can say that allergen is any kind of foreign protein. Yes. Excuse me. Yes, of course, it can be also either carbohydrate, either lipid, but basically it is a protein. When we are talking about infectious agents, we have three main groups. We have more groups, but mainly we have three. Is bacterial, viral, and fungal, right? And here we should keep in mind that all of them, they have their own proteins, they have their own lipids and their own sugars or carbohydrates. And all of these particles of them could be allergic, could be antigenic for us. What means antigen? It is just as allergen. Allergen is kind of antigen. So they have allergenic capacity. Basically any particle of infectious agents. Now, when we are talking about non-specific immunity, that means as non-specific immunity we can start with the first line defense of our bodies, like skin, mucous membrane, gastric acid, lysozyme in saliva and in tears, and so on. Such factors are first line defense, and they are making part of non-specific protection. Yes, it is not immunity, but it is non-specific protection. When we are talking more specifically about immunity, non-specific immunity can make part complement. Yes, can be phagocytes. Yes, white blood cells. And why they are called non-specific? They are not selective. They do not choose by special features. The only thing is important for these substances or for these cells is foreign body. That's it. This is why phagocytes or macrophages are able to infulg bacteria. They're able to engulf some own particles, some own damaged cells. They consume everything. They digest these structures, and they are dying. This process is called purulent process. This is how pus will be produced. Pus is not accumulation of bacteria. Pus is accumulation of dead white blood cells, these component tissues, still alive white blood cells, bacteria, and their particles. This is the most composition of the pus. This is why not every time you will find bacteria in the pus. You can find it around. For example, on the bottom of the lesion, not in the pus, but in the bottom of the lesion. Okay, this is an example of non-specific immunity. What is specific immunity? Specific immunity is ability of our immune system to produce special proteins that we can call immunoglobulins or antibodies or alpha, beta, gamma globulins and so on. They have more synonyms, but all of them are antibodies. In order to have a good protection, our body is to be able to produce both non-specific and specific immunity. That means our body is to be able to fight with everything and to produce specific solutions against specific pathogens. Whenever our body is attacked by any kind of antigen, and we already know that antigen is any foreign protein. As counteraction for this attack, our body starts producing another protein with complementary structure. What does it mean? What means complementary? Please don't misuse with similar structure. Similar structure is when they look the same. Complementary structure when they look opposite. Like puzzles, yes? It is complementary structure. When one structure can attach to another one, when they can fit together. How this process happens? In order to keep in mind how this process happens, we should remind which kinds of lymphocytes, which types of lymphocytes we have in our immune system, are produced by our immune system. B lymphocytes and T lymphocytes. Okay, B lymphocytes are produced in bone marrow and are getting mature in bone marrow. Yes? T lymphocytes are produced in thymus, bone marrow, and they migrate into thymus, where they pass the process of maturization or differentiation. Okay? Why B lymphocytes are called so? Not because of bone marrow. Meanwhile, I would like to change the definition and to say that B lymphocytes are called so because of bone marrow, but no. For the first time, B lymphocytes have been described by a scientist, Fabricius, who discovered in birds a specific lymphoid tissue that is so-called bursa fabricii. That means it is a bursa. It's a lymphatic node or tissue that looks like bursa, which were discovered and described by scientist Fabricius. So because of bursa, it is B lymphocyte. But in order to keep in mind, it's very good to say bone marrow. Yes? T lymphocytes because of differentiation or maturization in thymus. Now, T lymphocytes are dividing in other categories. We have T. Louder. T killers, T helpers, T suppressors. What else? T memory. Is it all? Huh? Okay, which is the function of T killers? To kill. Whom? Louder? Not foreign. Own cells. T killers are responsible on daily prevention of cancer in our body. Because each day, a lot of cells in our body can, by influence of different factors, can pass through some mutations. And they start multiplying without any control. This is how cancer appears. So T killers are responsible to detect damaged or mutated cells and to kill them. This is how our body keeps alive for a specific period, for a certain period. And this is why cancer is considered to be a disease of elderly people. Yes, last years it becomes younger. Why? Because most of the population do not care about their health and about their immunity. So, immunity will fail faster and cancer will come faster. Now, T killers, that's clear. T helpers, which is the function of T helpers? Help me, please. Who could help me? T helpers. I lost my T memory. Who could help me? T helpers are helping to do what? Louder? Louder.
Second antibodies by activating.
Activating production of antibodies. Very good. Okay. And T memory?
They are identifying the old ones.
Yes. We have two types of immune response. Initial immune response and secondary immune response. Initial immune response is longer. When you saw me for the first time last week, which was your reaction? Did you see me before?
Yes. They taught it before. You taught our class before.
Your class.
Like 1/3 of our class.
So that means that for somebody, it wasn't the first sight. Yes, it wasn't the first meeting. So here, when I came, somebody maybe, or again him. But you already have an opinion about me, and it is either good one, either bad one. But you already have it. So you had a faster reaction on my appearance. So if we will meet each other in the street, you will probably recognize me. I will probably recognize you. And it will not be the first meeting anymore. So the reaction will be faster on known face, right? Now, if you didn't ever see me before, and you went to walk around for shopping in the mall, and I can see you there because I'm also walking around with my family there, yes? For some reason, there is more chances I will recognize you, but not you will recognize me, because simply I know that most of Indian students you can meet in Moldova are making medicine, yes? And probably if we didn't meet till now, we'll meet maybe later. But you will never react on my presence in another place because you don't know me. That's normal. So, one more reason why I will recognize you faster. You know why? Foreign bodies. Okay, no offense. Good. This is how you can keep in mind, yes? Good. Now, this is the difference between first meeting and other next meetings. Our immune system, when it meets for the first time a foreign protein, T helpers will start helping activating production of antibodies. If we already met each other without affection of T helpers, we have T memory with database of all the mostly recent proteins for which we already produced recently some antibodies. So this response will be much faster if for the first immune response we need from 1 week up to 1 month of immunity production. For the next immune responses, that's enough up to 1 day for production of enough amount of antibodies. This is how important is secondary immune response, and this is how important could be vaccination, because vaccination is first immune response without any disease. This is what you should keep in mind about vaccination. Whenever you have to choose a vaccination or a disease, all the time vaccination is better. Even if everybody and even doctors are saying we didn't test this vaccine good enough, even this vaccine that is in the process of clinical trials, I will choose this one because I know all the time it will be much more safe than the disease. And it doesn't matter how light is that disease. Vaccination all the time is lighter and easier and better. Do we have any risks? Yes, like anywhere. But less risks in vaccination. And it gives us fast secondary response and good protection against infections. It is about T helpers and T memories, difference in their work. What about T suppressors? As well as you can observe about each of them, it is possible to make the entire lecture. T suppressors, their name is very representative. Their function is to suppress immune response. Because I don't know how aware you are about the fact that our immune system is extremely strong mechanism. It is very small mechanism, but extremely strong mechanism. And here's an example. Recently we passed through a pandemic situation. A lot of people got infected with coronavirus. A lot of people got infected and not once. Most of people passed easily through this infection. A little bit less people passed so-so. And small, but not too small, group of people passed through extremely severe forms of this infection. And a lot of them died. I'm pretty sure you knew somebody personally who died because of coronavirus infection, right? Right, me too. All of us. So, and they've been waiting so much for vaccination. A little bit, we didn't succeed. What happens when you are sick? A lot of pathogens are circulating or are present in my body when I'm sick. And specifically, if it is a viral infection, generalized viral infection, or it can be bacterial infection, but it can be bloodstream infection or septicemia, whatever. As much antigen will get into our bloodstream, as more severe will be response of our immune system. And very often, a lot of symptoms of the infectious disease are coming not necessarily from the pathogen itself, but from our immune system. Did you ever think about it? That most of symptoms in infectious disease are coming from immune system, are caused by immune system, but not by pathogen. Yes, in some cases it can deviate more or less. Here's an example. What happens when we get a general infection? Which symptoms we get? Fever. This is first thing we ever mention, fever. Which is the reason of fever and which is the purpose of fever? Tell me, please. Please learn to have your own bottle. Even if you are doing it, you are drinking contactless, no matter. It is infectious prevention, yes? Especially now in this cold period. Okay, which is the mechanism of appearance of fever, and which is the reason? Do we need fever? Does it help us?
Yes.
Why? How? Who told yes? Please give me a reason. Is fever useful for us or useless? Again?
To an extent, it is yes, like for killing bacteria.
Killing bacteria. Okay. This is the mostly spreaded fake about fever. It is spreaded even among medical staff. It is not surprise. It is very common. Why it is that spreaded? Because, again, just as we discussed last week, not too much people are paying attention to microbiology, to epidemiology. Why? There are much more exciting specialties in this world, and in medicine including. Do you remember sterilization?
Yes.
Do you remember which temperature is necessary to kill pathogens? If we're talking about strictly pathogenic bacteria that are more susceptible to the environmental factors, that means they are more vulnerable on temperature. Starting with 60 degrees Celsius, they will start dying. If we're talking about conditionally pathogenic bacteria, it can be up to 100 degrees Celsius. Can our body produce such temperatures? No. Can we survive if we pass through such temperature? If our body will reach such temperature? No. Even if we don't know sterilization and temperature that is effective, that is efficient against pathogens. Tell me why, whenever we have fever, we take antipyretics, if fever is useful for us. Tell me why we have drugs that decrease fever, if fever is good for us. A lot of people are using these drugs, and at the same time, a lot of people are thinking that fever is good, that fever is fighting against pathogens. So it doesn't make any sense, right? That means the only good thing about fever is it plays role of alarm. It is the first sign that something is wrong in our body. The only good thing about fever. Now, how it happens? What happens? As well as we already told, in our bloodstream starts circulating some antigens, some foreign proteins. As a response on these proteins circulation, our immune system starts producing so-called interleukins, or they are also called cytokines. These cytokines are circulating in our bloodstream, and their amount will depend on amount of the antigen circulating in the bloodstream. As more antigen we have circulating in the bloodstream, that means as more virus or bacteria circulating in our bloodstream, or their particles, as more cytokines will be produced. These cytokines are passing through the center of thermoregulation, yes, in hypothalamus. It bothers this center, and what happens? Starts this balance of feelings with reality. That means our receptors starts receiving, our thermic receptors all around the body, starts receiving wrong signals, or our center of thermoregulation starts misinterpreting the signals from the receptors we receive from the outside. As a result, our brain, our center of thermoregulation, will understand, or will understand the temperature of the environment as lower than it is. So we feel it cooler than it is. As a result, we have chills. Yes? Did you ever think about fact? You never sweat during fever. You never sweat during fever. And now some of you are agree with me, and some of you, wait, what? No. I remember very good. I remember very good. Recently I've been sick. Yes? And how it finished? With sweating, right? But it wasn't during fever, it was after fever. Now I explain the process. When you feel from the outside that is cool, everything contracts. Your skin contracts, all the pores contract, and you don't have any chance to sweat. Even if in the reality you are hot, you have fever. So why we have fever? As a result of misinterpretation of signals from the outside, our body starts producing extra heat, extra energy is burning, and our body temperature will increase. Now, what happens next? What happens next? If you want to, you discovered you have fever, you checked you have fever. What is fever? It is body temperature increasing over 38 degrees Celsius. From 37 till 38 is subfebrile temperature. It's not fever. It's subfebrile temperature. It's already abnormal, but it is still not fever. Starting from 38 and upper, it is fever. So our body temperature is increasing, and this increasing is caused by intrinsic factors, because summer it can be hot outside, and your body temperature also can increase up to 40 degrees Celsius. But it is not fever, it is hyperthermia. It is increasing of temperature because of hot environment. And as soon as you will get in a cooler place, it will settle down. So there is a difference. Fever is temperature, body temperature over 38 degrees Celsius caused by intrinsic factors, basically infectious factors. And if my body feels it is cool, it is cold, there is no chance pores to open and sweating start. No way. What happens? I feel I have chills. I realize probably I have a fever. I check it out. I find out that I have fever. I take some pills, for example, paracetamol, ibuprofen, or something like that, Nurofen. And these drugs are fighting with mechanisms of inflammatory process. They decrease amount of circulating cytokines in the bloodstream. They stop bothering our thermoregulation center. Our body starts understanding surrounding temperature as correctly. And finally, our body feels it is too hot. And now we need to eliminate a little bit of extra temperature. Pores are opening, sweating starts, but usually in this moment we do sleep, right? So you don't know that fever finished before. You start sweating after the end of fever. This is why I told you never sweat during fever, you sweat after fever. Some people misunderstand and they think that sweating helps fever to decrease. And they recommend to others, if you have fever, make physical effort, so you sweat, and it will never do it. That's so stupid. Never do it. It's really dangerous. You can make it worse. So never do it. Apply classical treatment. Now, this is the mechanism that happens when our immunity starts working. If you keep in mind, it is recommended to start decreasing fever if we have basically fever. If we have body temperature like subfebrile temperature between 37 and 38 degrees Celsius, it is not recommended to apply immediately paracetamol or other antipyretics, right? It is not recommended. Does it mean you don't have any right to do it? You can do it. Is it dangerous? No, it is not. The idea is that if you have 38 degrees Celsius, it is extremely dangerous to not decrease, to not treat fever with drugs. It is very dangerous. Why? And now we are coming back to T suppressors. Our immune system is a very strong machine, is a very strong mechanism. And a good machine, a good car, needs two main mechanisms. Engine, good engine, yes? And, guys? Good brakes. Did you ever ride a bicycle without brakes?
Yes.
Maybe we don't have enough drivers here, maybe, yes? But for sure, all of us, or almost all of us, had that awesome chance to ride a bicycle with broken brakes. Did you?
Yes.
How it feels? In the beginning, it's okay. But when you realize you need to stop, and you cannot, and you need to use as a brake your own body, if you don't know how to do it in a different way. Immune system is a very good car with a very strong engine, with T helpers, with T killers, with T memory, with T and with a good brake that is called T suppressor. So if our immunity loses this function of self-control, you can observe that if you don't treat fever, it will not stop itself. If it doesn't stop itself, our the temperature will increase till the lethal moment. There is a temperature we cannot support. Proteins in the blood will start coagulating. Some organs will stop miss working, and so on. So, if brakes are not enough, we need to apply brakes from the outside. But T suppressors are cells that are controlling work of other cells of immunity. And now coming to specific part. Till now we've been talking just about T cells. And now we have B cells. Which is the function of B cells? Production of antibodies. How? With help of T cells, and specifically T helpers and T memory, B cells are activated. When B cell is activated, it changes a little bit in structure, and it becomes not B cell, but what? Plasmocytes. Did you hear about plasmocytes? Plasmocytes are ex-B cells. And now, when B cell is activated by a specific T cell, with information about the structure of the protein we need to produce, plasmocytes, they start producing these specific proteins. They produce until this plasmocyte disappears. So this is how it works. Now, if we have specific antigen and we have specific antibody with complementary structure, this antibody will bind the antigen. That means this the antigen that presents usually receptor of the pathogen will not be able to attach not to blood cells, not to other surfaces. It will not be able to make its own metabolic processes, and it will die. So as soon as you bind all the receptors around the pathogen, it becomes useless, it becomes dependent on these antibodies, and it is not able to produce any harm. Now, antigens and antibodies, reaction between them happens in two conditions. In vivo, yes, and in vitro, correct. When we are talking about in vivo reaction between antigen and antibodies, usually it is about healing from a disease. Either it is self-healing by immune system, either it is treatment with antibodies. Yes, we have immunoglobulins against each infection, and if it is available, we can inject immunoglobulins in the bloodstream. And these antibodies will start circulating all over the body and will start capturing all the antigens. By this way, soon enough, all the pathogens will be blocked, will be neutralized, and the infectious process and infectious disease will stop. And also, reaction between antigen and antibody can happen in vitro. When we are talking about in vitro, it is any lab reaction. So we take antigen, we take antibody, we put them together. If reaction happens, it is called positive reaction. If reaction doesn't happen, it is called negative reaction. In which case reaction happens, and what means reaction happened? Reaction happens if antigen and antibodies are complementary. That means they can attach to each other. If they can attach to each other, that means these antibodies are against these specific antigens. This is why it is called specific immunity. For which reason we apply these reactions? Why do we make reaction between antigen and antibody? With diagnostical reason or purpose. And there are two main groups. Excuse me. There are two main groups of serological reactions. Serological reaction is a reaction between antigen and antibody. There are two main groups: serodiagnosis and seroidentification. I guess you heard about it. Serodiagnosis means looking for unknown antibody by using known antigen. What does it mean? What is unknown? Unknown, it is something we take from patient. Known is something we have in our kits in lab. We have a kit with liquids, and it is written antigen, anti-flu antigen, anti-COVID antigen, anti-rabies antigen. For any pathogen, we can have kits with antigen. What do we take from patient in order to find antibodies? Where do we find antibodies? In blood. In blood. Yes, we can find them in other places, but mostly in blood. So we take blood from patient, we take known antigen, we put them together. If there is positive reaction, that means we found out what did we find? does the person has antibodies against specific infection. So we check for immunity, not for infection. So if it is IgM, it says about acute or recent infection. If it is IgG, it is chronic or all time ago past infection. So by serodiagnosis, we check for immunity or for presence of antibodies in the bloodstream. And we have seroidentification. Seroidentification is finding of unknown antigen by using known antibodies. So just as we have specific kits with antigens, we can have specific kits with antibodies. We take a specimen from patient, we put them together. If reaction happens, that means antigen is present. Did you ever make antigen test against COVID? Yes, and not once. Maybe even antibody test, but not that often, right? Did you observe that you didn't make too much tests for antibodies, maybe even didn't at all, right? But you did antigen test because it is fastest and cheapest, right? Now, why didn't you make antibody test? You didn't need to find out your immunity. You needed to find if you are infected right now, right? Just if you've been curious about your immune status regarding COVID, I've been curious and I did my antibody test. But if you didn't, you've been just forced sometimes, or you wanted sometimes to make COVID test, antigen test. So we take a specimen, and what do we take as a specimen from patient? It depends on symptoms. If we are talking specifically about COVID, we take a swab from the affected area. It is nasopharyngeal or oropharyngeal swab, just as for PCR test, right? But if it is another infection, for example, it can be bloodstream infection. In this case, you will not take swab, right? You will take blood. It can be skin infection. In this case, you will take some exudate from affected lesion, from the lesion, from affected area, right? And so on. If it is an intestinal infection, you will take some samples of stools from place with specific pathologic material, and so on. So when we are talking about seroidentification, that means looking for unknown antigen by using known antibodies, we take a specimen in dependence on symptoms from affected area. In this case, we can find what? A pathogen. A pathogen is full of antigens. We put them together, known antibodies, unknown antigen, reaction happens, they're clumping, we can see that reaction is positive, we can form the diagnosis. These are general terms how it happens. Now we have a lot of different types of serological tests, of bacteriological tests, a lot of different types. And how do you think? Which one is better? Bacteriological or serological? Which one is better and why? Which one is better, serological test or maybe PCR test? And here you are saying PCR. Why? Because it is more precise? Or because it is more expensive? If you own the lab, it is better PCR. Which one is better? It depends. It depends on what? Overall, the best option, I would say, so it is my personal opinion, that serological test is the best one for a lot of reasons. The first one is price. Especially when you need to cover a big group of population, low costs are important, first of all. Second, very easy to perform. Basically, any civilian, almost any civilian, can make it by itself and it will be quite precise. So it is easy to perform. 3, the fastest result ever. And when you're out of time, when you're out of forces, when you're out of money, you choose the option that is fast, that is cheaper, and that doesn't include too much stuff. This is why very soon we passed from PCR tests to antigen tests. And just if we had some doubts in antigen test, we made PCR test for few patients. That is considered to be more precise. But there is something important about precision of tests. There are some chances to have a false negative result. And false negative result in antigen test usually is due to wrong technique. Either the patient washed too much its nose. Did you ever have such cases? I have a friend, fortunately I had a friend who've been against, he'd been against everything, against doctors, against vaccination, against COVID. He didn't recognize till the moment that coronavirus exists. So he thought, you know what? He's a lawyer. He needs to go around, going abroad in different countries to represent his customers. So he thought, you know what? In order to travel for my business, all the time I need to make a PCR test or antigen test. And every time a doctor says, come in the morning, don't brush your teeth, don't wash your mouth, don't wash your nasal cavity. Come just as you wake up, come for the test, we make the test, and we give you the certificate. And he thought, thank you so much for instruction. With Listerine, with toothpaste, with soap, with shampoo, with anything he could, he washed his mouth and nose. He came to the lab. Why did he do that? He doesn't need to know is he infected or not. He needs to obtain a negative certificate to travel. Once it was okay because he wasn't infected. Second time it was okay. It was okay until the moment he got infected. And since he is already a little bit over mid-age, it wasn't the best experience in his life, if not to say it was according to his storytelling ability. It was one of worst experiences in his life. And he passed through, not through very light diseases a little bit earlier. Such category of people are in higher risk. After that, before he'd been saying all of these epidemiologists, all of these doctors, microbiologists, and so on, saying to me, my best friend, they think we are stupid. And I say, yes, of course, we also need, you're a lawyer, you're making somehow money. We're doctors, we also need to make some money, yes, no? So everybody survives how, of course, I've been joking, but he's been so upset. These doctors, they think we're stupid. They together with politicians, they want us to stop working, the economy will collapse, and so on and so on. Yes, you're right, go away. Okay, you're an exception, you're a good doctor, but okay, but I say the same things as they are saying. No, you understand, okay, don't be upset with me. I say, you know what? You cannot offend me. But hopefully, it will be like you are saying, not like I know. Like you think, but not like I know. And finally, after a long break, not talking to each other because both of us have been busy, not upset. After a long time, he's contacting me. And if till now he's been sending me like memes with those for vaccination and those for treatment and so on. After that, his first meme to me was like, the virus is not moving itself, it needs idiots to move it. You know? And picture of manifestation of riot of people without masks during pandemic. So it was his apologize. And after that he explained what happened to him. So sometimes you cannot imagine how genius could be patient for a while to avoid some results, some very important results. So this is an example of false negative result of virus, of antigen test. Another false negative result, if a person who took a swab wasn't experienced or have been lazy or didn't want to get a positive result and just up on around the nostrils, not till brains. till tears, you know. When you're crying during the swab, it's a good swab. If you don't, it's a bad swab. This is the, how can you check it out? So in such cases, we can have false negative result. But it is almost impossible to have false positive result. So if you have, also you can have unclear result. If the quality of the test is not good enough, you will not understand, is it just one strip or two or none of them? It will be unclear result. But it is almost impossible to have false positive result. This is why it doesn't make any sense if you already have a positive result to go to check it in PCR. If you had negative result but you're not sure because you have a lot of symptoms and you will need to find out what is it. Okay, it is a good idea to make PCR to confirm or infirm this or another infection. Tell me please, for the end, PCR, is it serodiagnosis or it is seroidentification? Who is for serodiagnosis? Who is for seroidentification? Why not everyone voted? Any other options? No? What means PCR? Now you don't have any excuse for giving a wrong answer, both of you, both groups. Polymerase chain reaction has nothing to antigens or antibodies. It is amplification of DNA or RNA of pathogen. It is molecular biological test, okay? Okay, good. Any questions? No? If you don't have any questions, that's it for today. You can be free. Have a nice week and keep safe.